Welcome to this presentation of the Joint Targeted Area Inspection findings in relation to the multi-agency response to children and families who need help. We'll start off with introductions, covering all the inspectorates. So I'm Paul Inverno, Specialist Advisor for Child Protection from Ofsted.
Hello, I'm Brian Murray, Child Protection Inspection Lead from HMICFRS.
And I'm Kay Goodfellow, Children's Services Inspector with the Care Quality Commission and the JTAI lead for the programme.
So we're the three inspectorates that undertook these joint targeted area inspections into this theme. So what we'll be covering is just to give a bit of context about the joint targeted area inspections. We highlight the nine main themes that we'll be covering, and obviously we'll be drawing a conclusion from that, and then we'll have links to resources. So in relation to the context and background, as you'll be aware, we do two types of inspection. We do inspections of the multi-agency response to the identification of initial need and risk, also known as the front door, and we do thematic inspections, and this is a report on our thematic JTAI on the multi-agency response to children and families who need help. Inspections took place between December 22 and March 23, and we went to 5 areas, as you can see below, and as I've highlighted, there were the 3 inspectorates that are represented here today. And we developed 6 main questions that we wanted to focus on during our JTAIs, and they cover themes such as how effective agencies work together to give children and families the help at the right time, about whether there's the shared strategic vision, how effectively local need is understood and that engagement with families. Importantly, does the workforce have the appropriate skills, knowledge and capacity to ensure that children and families get the right support? And in terms of monitoring and evaluation, do the partners effectively undertake this work through the local safeguarding partnership? One of the significant findings was the level of variation between how early help is delivered in local areas, and that was one of the overarching themes that we wanted to mention at the beginning. So we have presented our findings under 9 theme sections in the report. There's no particular hierarchy to these, but they are all interdependent on one another. That's why we want to present them as a whole picture. So we're going to take 3 themes at a time. So in terms of the first theme, resource pressures across universal and targeted services and local partnerships have made it hard to prioritise early help. And this is also getting harder with increased numbers of families needing help as a result of impacts such as the cost of living crisis. In terms of supportive ways of working that have a clear focus, included conducting a joint strategic needs analysis with attention to the needs of children. Importantly, strong alliances with the voluntary and community sector to ensure that partners are aligned and working well together. And accountability being with sufficiently senior staff who have that clear shared vision and intent to oversee early help services. Areas all took a very different approach, and only a few had structured their early help service to be a priority for the local children's safeguarding partnership. So moving to the next theme, in terms of children and families getting the right help at the right time, what we found is having the right representatives from agencies at meetings, and even the locations of meetings and being in person, made important differences to giving timely support. Having the right agency representation in the MASH meant that referrals were appropriately allocated and responded to more quickly. And what was really important is that everyone needs to be clear about what early help is and the role of early help within that local area. Many examples were found of referrers not knowing the outcomes of assessments or understanding that assessment may result in no further action. And workers at least need to know what happens at each assessment stage and be clear about the level of involvement a child and family are receiving. And because early help is voluntary for families, services need to work hard to engage positively with families so that they stay engaged. And we did see some really good examples of this. Questions frequently came up on inspection about whether more timely statutory intervention might reduce some of the risk children were facing sooner. Some children that remained with early help professionals would clearly have benefited from statutory social work intervention because of their high level of risk and need, or because their situation was not improving. And there were delays in these children and families with more complex needs and risks getting that right help. Building relationships with children and families is critical, and we saw again some really good examples of this, and having the right worker involved as well was really important. Keeping the same worker as children move through the system, for instance, from early help to statutory work, and conversely, is beneficial in for most children. In terms of responses and skilled workforce, staff working in early help services we visited were increasingly working with highly complex family situations. Sometimes this was above the level that they felt was appropriate for them in terms of their knowledge and skills, and this often led to less effective help in cases that would have benefited from social work involvement and more effective multi-agency working. Some of those families needed that professional expertise of a social worker and more robust oversight through reviews and monitoring of plans. Matching of children's needs and risks to the skills and experience of practitioners needs to be managed and monitored robustly. I'm going to move to Kay now.
Yep, thanks very much, Paul. So across the inspections, we saw some good examples of cross-sector working, and agencies within some areas work really closely together. And this was to provide training between services, and that made a notable improvement to the offer that practitioners had, and in turn, the support that they were able to offer to children and families. So for example, in Harrow, speech and language therapists were training early help workers to not only assess, but also deliver generic speech and language therapy sessions. And this upskilling was improving staff competency so that more children and families were able to get help. And it also meant that they were able to get support from a professional who they'd already built a trusting relationship with, and reduce that need for onward referral for some children and families. Thanks, Paul.
Thank you. So moving on to the next group of 3 themes. One of the themes that came out of this was the need for greater engagement and strategic consensus with partner agencies. And this was particularly the case with schools. Partners were not always equally engaged at a strategic level, and particular weaknesses were found in engaging schools at that strategic level, which is obviously really important. Though all partners were involved in the multi-agency safeguarding arrangements, most areas had one partner agency which not fully involved in meetings or with information sharing. Scrutiny and challenge wasn't always evident over these decisions and attendance at meetings. However, we also saw some good practice, which Brian's now going to discuss.
Thanks, Paul. Yeah, we saw some interesting work that Surrey County Council had completed, where it brought together its support, training and information offer for education into one service called that Surrey Education Services. That not only provided an accessible online hub of information, but as part of that there was an offer of specialist teachers for inclusive practice, and they're able to identify and support schools with various interventions. And what we saw was that they'd been able to build really close relationships with children in schools, and that had made a consistent bridge between the school, home, children, and really put education at the centre of their early help practice.
Thank you, Brian. So another important theme that came out was around evaluation and oversight of early help. So local safeguarding partnerships worked well, had a broad membership that covered all statutory partners, and education were well involved, as well as the other relevant services involved in early help. Successful partnerships had that regular communication through meetings, had a clear shared vision and processes in place that were clearly understood across the partnership to share information about issues in the local area, and effective processes for that oversight of early help. However, some really good early help work wasn't always known about across the partnership. Monitoring and oversight helps to identify and address gaps. The oversight of early help was not always a key component of safeguarding arrangements, nor was the effectiveness of early help always evaluated. We did not see a focus on evidence-led interventions and strategic planning within early help. Obviously, a consistent theme that's come through our JTAIs has been around information sharing and communication and the need for improvement in this area. Inspectors found the effectiveness of information sharing varied across local areas. Good data systems, clear processes, and a skilled and confident workforce are essential ingredients for good information sharing. And when information is shared effectively, that really makes a difference in terms of children receiving help more quickly. Consistently capturing valuable knowledge about children's background and identity, such as their ethnicity or languages they speak, really supported effective and timely support for families. What we saw was that where work was undertaken in silos by professionals and agencies, this formed a barrier to information not being effectively shared, including children's risk and need. All partners need to be able to access the same relevant information and understand what information to pass on to other partners. This is helped by good strategic oversight and management at that partnership level. Many workers spoke about not having access to systems and work being duplicated, and this made their contributions consuming and impractical. Partners need to be supported and encouraged to share information effectively. So just moving to Kay to talk in a bit more detail.
Yeah, thanks very much, Paul. So at this point, I suppose it's really worth highlighting the complexity of health services. Now, these are compounded by cross-border remits, complex structures, and of course, not forgetting fragmented IT systems. And this cannot be overstated, as every local area is different and each has their own set of challenges. Now, what we found through the inspections was that many local areas struggled with the number of different health providers and their information sharing systems, which were not effectively joined up. And failure to access health system records sometimes inhibited services from having a full oversight of risks and need. So, for example, within a number of multi-agency safeguarding hubs and MASHs and early help hubs, mental health information about children and parents was often difficult to access when the checks were carried out. However, that said, when local areas do commit sufficient resource into a MASH or an early help hub and ensure that there's clear guidance around access to relevant information from the full range of partners, there's a much better response. And they're able to bring together key professionals to facilitate early, better quality information sharing and analysis to support multi-agency decision making. And often the result of this is a wealth of information which provides a holistic view of the needs of the whole family and enables a more timely and appropriate response to need. Over to you, Brian.
Thanks, Kate. Yeah, and we saw some good work as well, just outside of that MASH environment where local information sharing at a community level can have an impact. So we saw that in Bedfordshire. The police there had started using a neighbourhood intelligence sharing portal that worked across a number of different agencies, and often agencies you wouldn't necessarily think about when thinking about safeguarding or early help. But what that allowed certainly the force and their partners there to do was to share information really quickly that might prevent escalation into things like criminality. So things as basic as antisocial behaviour involving local children at a park would prompt a response. And importantly, I think it let all of the partnership know what was going on, where the police activity might impact on various different issues, but really trying to nip things in the bud and letting people know what the outcome was, which of course is equally as important, that you know there is value in sharing that type of information as well.
Thanks very much, Brian. So moving on to the last three themes. So one of our findings was that local resources in relation to help and support for families were not consistently well understood or utilised. Many local areas were found to have a wide range of early help services provided by different partners and organisations, but they were not always known about by their communities and local partners. So children and families were not always signposted to services in a timely way, and services was not always reaching people they could be helping. We saw a few really good examples of apps and websites being used to signpost people to services. This meant that children could potentially be signposted to suitable support much faster via a medium which was much more accessible to them. Another really important theme that came out of this was working with communities to make services accessible. We saw some very different approaches in accessibility of early help services. Some areas structured their services around more of an earliest help approach, offering services that could be easily accessed without the need for a referral, for example, through walk-in services. And some areas really focus on understanding and removing the barriers and potential stigma attached to early help services, and making it as accessible as possible to children and families at the earliest stage. Ethnicity and culture are important to focus on to effectively support families. For example, we saw some excellent translation services. Also, there were some great examples of professionals noticing concerning patterns and finding working solutions that provide accessible early support to families who might otherwise miss out. Clay and Brian are now going to give a couple of important examples of this.
Yeah, thanks very much, Paul. So a really good example of this was over in Sunderland, where midwifery services noticed a high number of women on its postnatal ward were from overseas students from the university. Now, often these expectant mothers had not been booked in for antenatal services and therefore would not have received any antenatal care. So, having identified this need, the midwifery services collaborated with Sunderland University, the local authority and charities to develop a culturally aware antenatal service for students from an international community who are on campus. And all partners were committed to this initiative, and it helped to improve outcomes for these women and their babies. Brian, over to you.
Thanks, Kay. And another good example, really interesting work in the Wirral, where they used a comprehensive area needs analysis to develop an approach based on specific area needs. Engaged hundreds of families and agencies through consultation to assess the offer they had and then look to make improvements. And they found that there was a lack of trust towards services, so leaders focused on reducing barriers to make initial support easy and using that to build trust with communities. That resulted in the introduction of a domestic abuse hub, and a good example of accessible multi-agency local service design based on the needs of the analysis. That hub offers safe, confidential, in-person support to survivors of domestic abuse, and it brings together workers from a variety of different sources, so Children's Social Care, Merseyside Police, various local charities, and that allows survivors of domestic abuse to access a range of help in one place. And that positive work it does in the community is spread through word of mouth, creating sort of a virtuous circle, if you like, which encourages others to use the service. And it's also located with other facilities for families, somewhere to have tea and coffee, somewhere for families to bring their children to play, as well as a family drop-in centre, and that all makes it more appealing and potentially less stigmatising, but certainly successful in providing an accessible service. Over to you, Paul.
Thank you very much. So moving to the last theme, and what was really important was that there was a child-centered focus within a family-focused approach. So our inspections identified many examples of well-trained, experienced early help workers providing sensitive child-centered interventions. However, some of the work and systems in early help that inspectors saw lacked that sufficient focus on children's needs when work with families became too adult focused. In some instances, children's needs were completely overlooked. Inspectors found examples of areas consistently using specific assessment tools, and this was really good in terms of gathering that child's experience at different stages and over time, and this could build up a really powerful picture of a child's needs and experiences and progress. Including children in plans was important, and some areas also involved children in the development of tools and apps, which meant information could be more easily gathered and therefore available for professionals to be able to see in records to inform assessment, planning and intervention. So moving on to the conclusions. So just to reiterate some of the points that we've covered in this presentation and to reinforce some of these, in these JTAIs, we saw some excellent work at both a strategic and practice level. As said before, the most striking finding, however, was the variability in early help between and within the local areas. This was in relation to both what was available to children and families and how this was provided. The proposed government reforms to children's social care need to appreciate the variability between local areas, such as their differences in their understanding of the role of early help, strategy and practice, capacity across geographical areas and partners, and the real importance of keeping that child-centered focus within a family-focused approach. The films also need to remain responsive to the specific weaknesses that we found in some local areas. These included a lack of prioritisation and oversight. Partners in the masses need to really have that effective oversight of early help. We saw some weak processes in the early help, such as in some areas, such as no identified lead professional, assessment or effective plan, less effective multi-agency working, particularly with schools, and children's needs and risks not always being matched to lead professionals with the right skills, experience and knowledge. So the lack of capacity across agencies is likely to hinder progress in achieving the full vision of the reforms. So this is about areas really needing to be able to prioritise and invest in early help at all levels and in all agencies. I mean, one thing that we do want to highlight again, and I know we've given some good examples of this, is the importance of community engagement and accessible local services, which is at the centre of making a difference for families. And in terms of those examples and some of that excellent work we saw in engaging and developing services with communities, this needs to become expected practice across all local areas. All professionals need the skills and knowledge to assess, help and safeguard children and families effectively, and importantly to recognise risk and know when it needs to be escalated. The reforms need to consider that many complex cases are in early help and move between early help and children's social care. Work with children and families did not always take full account of the dynamic nature of need and risk for some of these children. And as we said before, practice at times can become too adult focused. So finally, statutory partners need to have effective oversight of early help, including the evaluation of the impact. Areas need a strong emphasis on making sure those partners are doing this. So moving on to the next slide, which is just the links to some of the resources, and obviously this on top of this presentation, it may well be that you're able to have the opportunity to read our report in full. Also to highlight the scoping study that Research and Practice were commissioned to undertake, which is a really useful document to read. And finally, just to, from the three of us, we say individually, to say thank you very much for listening to this presentation.
Thanks also very much from me.
Thanks from me.